Medical students have become increasingly interested in anesthesiology over the recent years. There's an incredible demand for students to learn, engage, participate in mentorship throughout all stages of their medical school careers. We see this best when looking at applicant match data from the National Residence Matching Program. Data from 2018 shows that the total applicants to anesthesiology was just over 2,000. And in 2023, the most recent year, there was nearly 3,000 applicants to anesthesiology. Medical students are seeking any way to get involved in anesthesiology, and for a large part that depends on their exposure at their home programs. However, most medical school programs do not provide formal exposure to clinical office-based anesthesiology.
In recent years, office-based anesthesia has grown exponentially. In 2005, the American Society of Anesthesiologists estimated that 10 million office-based cases were performed. New studies estimate 144 million ambulatory cases are performed in 2023, of which 20% or roughly 30 million are office-based.
The office-based anesthesia mobile community has responded to this need and is emerging as a distinct subspecialty in anesthesiology. To address the growing need for office-based procedures, we've decided to form the next generation of office-based anesthesiologists under the mentorship of Dr. Fred Shapiro. He serves as Director of Research and Medical Student Education at Mass Eye and Ear and as the Vice President for the Society of Ambulatory Anesthesia, who serves as an international leader in patient safety and office-based anesthesia at Harvard Medical School, created a one-week mentor-mentee office-based anesthesia experience for medical students to get involved in this area of anesthesiology. The American Society of Anesthesiologists has established guidelines for the administration of safe office-based anesthesia. Using these guidelines, as well as the learned expertise of Dr. Shapiro and his colleagues, we have combined mentorship and office-based anesthesia to teach students the 6 Ps of anesthesiology in a safe and pleasant environment. As office-based anesthesia expands, our communities now have more complex patients with comorbidities that need to be addressed during their operation, such as cardiac and pulmonary disease, implantable devices, obesity, obstructive sleep apnea, dialysis, and chronic pain syndromes. In addition, procedure complexity has expanded from cosmetic, chronic pain, and dental procedures to interventional vascular atherectomies, orthopedic procedures such as total joints, gynecologic fibroid embolization, and urological stents. A major learning component is how the acuity and needs of the patient can be managed in an office-based setting through proper assessment. A key question to ask ourselves, is the office the safest place to perform the procedure on a particular patient?
The mobile anesthesia care team operates as a team of providers to deliver the highest quality of care to patients. Students will not only learn how mobile anesthesia providers function as independent contractors, but engage every member of the care team in order to deliver safe anesthesia to patients. Every member is educated in emergencies, and office-based anesthesia thrives in ensuring communication and collaboration. Local and state guidelines, safety checklists, and cognitive aids have been set by multiple national organizations, such as the Joint Commission, the Accreditation Association for Ambulatory Healthcare, the American Association for Accreditation of Ambulatory Surgery Facilities, and the Institute for Safety in Office-Based Surgery to enhance patient safety in the office-based environment.
When participating in this experience, Dr. Shapiro has organized a partner system aligning medical students with a safe, vetted, and trusted mentor around the USA who follows the 6 Ps. I go to medical school in Kansas City and was partnered with Dr. Cassie Dietrich.
I'm a medical student in Massachusetts, and I was matched with Dr. Megan Malik in Chicago, Illinois.
I'm a medical student in Washington, D.C., and I shadowed Dr. Lee Dorsch in Virginia.
Over the past 10 years, office-based anesthesiology has served to fill the exceptional need for patients in interventional vascular, gynecology, dental, plastics, and children with special needs due to hospitals being backlogged. Furthermore, during my experience, I was exposed to a fun and exciting field of anesthesiology I was not aware of previously. We had to be flexible with our setup in each environment, such as hanging our IV bags from the ceiling or carrying children from one room to the next after they receive a small dose of sedative to help reduce their anxiety. Dr. Dietrich taught me how to focus on patient safety while providing humane care for those we serve.
Under the mentorship of Dr. Megan Ballack, I saw a wide variety of cases every day and learned about the enhanced patient satisfaction, the reduced healthcare costs, and the improved efficiency that office-based anesthesiology provides. Children with disabilities often find it traumatizing to return to the hospital setting for routine care. The ability for office-based anesthesiology to allow these families the option to conduct their care in a familiar, quiet, and safe environment is paramount. Furthermore, office-based anesthesiology makes the experience for the surgeon extremely convenient, as they can both perform their procedures and conduct office visits in the same setting.
I worked under Dr. Lee Dorish in Virginia and learned how office-based anesthesia is brought to rural areas 30-plus miles outside of a major city. Dr. Dorish brought her mobile anesthesiology modules filled with equipment to each office, including emergency essentials to a pediatric dentist's office, oral maxillofacial surgery centers, and endoscopy suites. She showed me how to care for a range of ages and procedures all in the office setting. Through this approach, we provided personal anesthetic care through the 6 Ps. Dr. Dorish tailored her care to meet the needs of each child based on their previous anesthetic experience and comorbidities to provide safe anesthesia. This not only eased the worries of parents with direct supervision from a board-certified anesthesiologist, but it made for a smooth and safe procedure. Having the proper support team in place, whether that be anesthesiology technicians setting up the rooms the day before, or a nurse to assist you during the procedure, office-based anesthesiology is designed to support the anesthesia care team to treat their community.
The office-based anesthesiology experience for medical students will expand possibilities for all medical students and empower those that do not have access to a home anesthesiology training program.
I am a medical student in Kansas City.
I'm a medical student in Boston.
And I am a medical student in Washington, D.C.
Together, we are promoting a unique educational office-based anesthesia experience for medical students and are developing a community for the next generation.
As you can see from our experiences, we are around the United States.
Regardless if your medical school is in a rural or urban environment, there's office-based anesthesia happening around you, waiting for you to explore it. We are so excited to present the office-based anesthesiology experience for medical students, and we are excited to receive your application.